The way we test for prostate cancer is a two-pronged approach. One is with using a blood test called PSA, and the other is by using a digital rectal exam to examine the prostate. PSA testing, as you may have heard about or read, has been somewhat controversial, but we still feel that it is very important and valuable test to help us get information about a man's risk for prostate cancer. PSA is a protein that's made by the prostate. It gets into the bloodstream, and we know that PSA is not perfect, and the reason it's not perfect is because it's made by the normal prostate just as well as it's made by prostate cancer cells. And so for that reason, there are other reasons that PSA can be elevated. But what we do is we use this test to look and try and assess a man's risk for prostate cancer. Other reasons that PSA can be elevated are infection, even sexual activity, even ejaculation can cause the PSA to go up. Any manipulation of the prostate, if someone's just had an exam, can cause the PSA to go up, or sometimes other inflammatory causes that we don't always have a great handle on. So just because your PSA is elevated does not mean you have prostate cancer, but it's important to think about investigating it and at least have the discussion with your physician. Then there's the question of whether to get a PSA done at all. In 2011, the U.S. Preventive Services Task Force decided that PSA testing was not of value. And this was based on a couple of two randomized trials that had been done that they determined, based on their analysis of these trials, that it wasn't a worthwhile test. However, all of the organizations, including the American Cancer Society, the American Urological Association, the National Comprehensive Cancer Network, these organizations of individuals who take care of men with prostate cancer, we still held value in PSA and still in our guidelines recommended PSA testing, or at least discussing it with your physician. And actually just this past spring, the U.S. Preventive Services Task Force has reversed their original decision in 2011 and has come back to agreeing that PSA testing should be discussed with your physician, and patients should be educated about the risks and benefits of PSA testing.